A certified registered nurse anesthetist is an advanced practice nurse provider
who has had several years of critical care experience and then has gone to graduate school and has been prepared with a master's degree.
The study of anesthesiology means that you are experts in the field of anesthesia. And when a nurse does it, it is the practice of nursing.
We are the person who is in the operating room with you throughout your surgical procedure, ensuring that you are safe and comfortable.
Nurse anesthetists have been providing care to patients for over 150 years.
Anesthesia is actually the domain of nursing, dentistry, and medicine in the United States. And the titles just refer to the formal training the anesthesia provider has before specializing in anesthesia.
We provide the same services that an anesthesiologist does in the same settings with the same standards and the same requirements that we have for providing safe and effective patient care.
We're prepared through different means, but we end up doing the same clinical work.
CRNAs are the primary providers of anesthesia care to active U.S. military personnel.
We would go on board ships that had operating rooms such as aircraft carriers.
My experience downrange has been the sole anesthesia provider on a forward surgical team. I've performed over 200 combat anesthetics. I've done everything from neurosurgery to exploratory laparotomies on 1-year-old after their mother detonated an IED suicide vest. I've seen American soldiers die, and I've seen American soldiers live, all as the sole anesthesia provider.
But once stateside, many CRNAs are not allowed to practice to the full scope of their education and training.
The difference between working in a military treatment facility or in the military is I am the anesthesia provider. I am not medically directed. I am not supervised. I am the person that decides the treatment. I assess the patient. I make sure that the treatment that I have fits not only the case that I'm going to do, but the environment that I'm working in as well.
So a big issue that we see is when we were far forward, we had very clear understandings that while we were independent providers, we always are part of that bigger healthcare team. What we see here is we see each individual VA is able to set the practice of what their nurse anesthetist can do. This need for hierarchical supervision creates a redundancy in care. That redundancy in care does limit access.
CRNAs are ready, and particularly former military CRNAs are ready to go into the VA if given full practice authority and be able to serve these veterans quickly so that their needs can be met, taken care of. The removal of practice restrictions, and whether you're in the VA or any other facility across the United States, means CRNAs will be able to serve the public, their patients, to the full scope of their abilities. But more importantly, this is about access to cost-effective, safe care. The studies have been done. There is no difference between whether an anesthesiologist does your case, a CRNA does your case, or we do your case together.
Some nurse anesthetists are committed to rural America. Some nurse anesthetists are committed to the public health, working on our reservations for Native Americans. Some nurse anesthetists work very, very hard at inner city hospitals with very, very little reimbursement. I'm proud to say that my calling was to serve our sons and daughters in faraway lands, in dangerous conditions, with very limited equipment.
I urge all barriers to practice for CRNAs be removed, especially in the Veterans Administration system. The reality is that there's 22 million veterans who need help. They need access to care.
To learn more about anesthesia care and certified registered nurse anesthetists, visit our website at crnasafe.com.